Hello again, this is Dr. Tolulope Alugo from St. John Cap. Today we'll be discussing about ADHD to treat or not to treat. What is the rationale for treating ADHD? We know that when attention deficit hyperactivity disorder is left untreated, particularly in children, there continues to be learning gaps. So these children fall behind their peers and will not perform optimally in the classroom. That means their ultimate potential will be limited. In adults, the consequences or the risks of not treating ADHD include, challenges with relationships, job losses, substance use, accidents, and so on. So I would say it is beneficial to consider treating ADHD. Now, what are the treatment options for ADHD? People always assume it's just medication. Not at all. There are non-medication strategies and also medication strategies. So first and foremost, we'll start with the non-medication strategies. Usually we endeavor to encourage parents to go through parent training. What this entails is education about what ADHD is, how to parent a child with ADHD, strategies at home that can be used, and this will be covered in other videos. Also, teacher training, so information for teachers on how to handle that youth with ADHD in your classroom, strategies to maintain their attention, to keep them on task, and to give them regular breaks. Also, things like using lists, reminders for the older kids, alarms, and so on. Behavioral charts to improve positive behavior, reduce impulsivity are also some of the strategies that have been employed. As the child gets older, you want to also educate them about their condition so they understand why they have the symptoms they do, and they can also learn certain strategies. They can learn to use lists and reminders. They learn strategies to keep themselves on task. They remember to take regular breaks, and so on and so forth. Medication. There won't be. This is not a session that would replace medical advice from your medical practitioner, but I'll just provide some broad information about medication. Medication is used for moderate to severe ADHD, where non-medication strategies alone are not sufficient, particularly where there continues to be learning gaps, where functioning at school, at home, or in the society is severely impaired by ADHD symptoms. The commonest medications are the stimulants, but you also have the non-stimulant medication. If you want to explore medications for ADHD, it will be important to speak to your pediatrician or family physician or nurse practitioner, and they will be able to carry out certain assessments, determine if you truly have a diagnosis of ADHD. They may refer you to a specialist and then decide whether you're appropriate for medication or whether your child is appropriate for medication or not. Important information to bring with you to this appointment with your medical practitioner includes, examples of symptoms that you've seen at home or in the classroom, reports from the school, previous school reports, for example. Also, information about family history, any medical history, any medications that you or your child may be prescribed, and any other mental health diagnoses that you may have. So it is important to get as much information as you can and to have a fulsome discussion with your healthcare practitioner on whether or not you actually have ADHD or whether your child has ADHD and the treatment options that can be considered. Thank you for listening. Please don't forget to subscribe, share this information with people that may find it beneficial. Follow us on Instagram at St. John Cap, where we also continue to share regular mental health information. Please comment below if there are particular areas you want to see us talk about. Thank you.